Hi, good day, good afternoon to you, wherever you're located. I'm Otis Toussaint, and I'm here for the Office of the Surgeon General. And we're talking today during our final live stream event for the day. It's with one of our brightest and best medical professionals. We're going to talk about Army hearing, and we're going to talk to today Lieutenant Colonel John Merkley. And I hope that you enjoyed today's discussion. We're going to have a little bit of a video. Then we're going to ask some questions with Dr. Merkley. So without further ado, I'd like to introduce you to Dr. John Merkley. Hi, sir. How you doing?
I'm good. Thank you, Mr. Toussaint. It's good to be with you today.
Absolutely, absolutely. I really appreciate you taking the time and coming and talking with us, giving us your medical expertise as far as the new technologies that we've got coming out for Army hearing, especially in this new virtual reality, COVID-19 reality that we're living in.
Right. Yeah, I'm excited to talk a little bit about, and to introduce some of the work that the Army Hearing Program is doing in this COVID environment. There are three initiatives that I want to introduce you to. Mr. Toussaint and I put together a short video to explain some of those initiatives, and then after we watch that video, we'll come back and we can discuss that a little bit further.
Absolutely, absolutely, sir. Yeah, it was a good production. We had a good time. I got a good chance to really see the advances in technology that we have in Army hearing, just how important that Army hearing is. But before we go into the video, sir, if you could just talk to us, in a quick blurb, why exactly is Army hearing? Why is hearing readiness so important?
Well, that's important to know. Hearing readiness is critical to soldier function on the battlefield. We have done studies after studies have shown that good hearing is a combat multiplier. Poor hearing on the battlefield can lead to problems. It can lead to fratricide. It can lead to enemy missing targets on the enemy, and poor hearing actually has been shown to reduce soldier effectiveness, soldier lethality, and soldier survivability on the battlefield. So we are very interested in preserving good hearing health for our soldiers while they're in their youth, while they're the combat, they're taking the fight to the enemy, so they can do that effectively, and then enjoy better quality of life later on. There are multiple studies that show that poor hearing leads to poor quality of life later on. So we're interested in the here and now, taking care of the warfighter so that they can complete their mission now and then enjoy life later on.
Absolutely, sir. And you did hit the point there. Hearing, especially a quality of life post the military, because we all will leave the uniform one day. It's absolutely important and imperative that you take care of your hearing, take care of your ears, take care of the plugs that you put in your ears, making sure that it fits right, that it's well done, that it's tested and retested and rechecked continuously, just to preserve your quality of life post military, especially as well. So, sir, let's go ahead and transition into the video. I hope that everyone gets a chance to enjoy the video that we put together, and here we go.
Hi, I'm Lieutenant Colonel Andy Merkley. I'm the Army Hearing Program Manager for the Army Hearing Program located at the Army Public Health Center at Aberdeen Proving Grounds, Edgewood area in Maryland. Our shop, the Hearing Program shop, is responsible for monitoring all areas of the Army Hearing Program, including hearing readiness, clinical hearing, operational hearing, and the general hearing conservation program for the Army. We also support the Reserve and the National Guard. Our staff consists of acoustic engineers and audiologists, and then some technical staff that support all the Army Hearing Program with equipment and technical expertise. Our acoustic engineers evaluate blast exposure. They evaluate noise hazards for equipment and weapon systems across the Army and across the DoD. Our audiologists monitor the surveillance audiometry and provide professional expertise to the field related to audiometry, surveillance audiometry, and the clinical audiometry aspects of the hearing program. Today, I'm going to talk, I'd like to introduce you to 3 initiatives that the Army Hearing Program is currently undertaking. The first is related to boothless hearing testing. So most of you have had your hearing tested with the Defense Occupational Environmental Health Readiness System for hearing conservation, where you go into a clinic, sit down in an audiometric booth, and a technician comes and administers a hearing test. This capability allows us to take that testing outside of a sound-treated room, which supports 2 primary areas right now: the COVID-19 recovery related to the reduction in hearing testing that occurred once COVID struck, and we all had to not stop hearing testing, but reduce hearing testing to make it safe. This effort will allow us to bring hearing testing to the individual rather than the individual having to go into a clinical environment and getting tested inside a booth. It can be easily administered by a certified technician in the field, and we are currently getting ready to train technicians on how to use this equipment. In addition to the benefits that we get with the COVID environment, it is also technology that allows audiologists to take hearing testing far forward on the battlefield and conduct assessments of individuals that have been wounded or injured on the battlefield, and take a look at their hearing and decide, is this an individual that can remain on the battlefield, or do they need to be evacuated to the rear, without needing to have a large audiometric sound booth accompanying the audiologist. The other technology that we're looking at is hearing protection fit testing. This is a technology that allows us to take a user of a hearing protector and evaluate exactly how much protection that user is getting from the hearing protection that they fit themselves, versus having to, read a label on a package of hearing protection that has a noise reduction rating and guessing as to whether or not that individual is getting as much protection as they need. This is a recommended best practice both by the National Institute for Occupational Safety and Health and the National Hearing Conservation Association. And we're looking forward to getting this technology out into the field to better protect our service members and our noise-exposed civilians. The other effort that we are involved with is transitioning hearing technician training. So all technicians that conduct hearing testing in the workplace need to be certified to conduct that testing, and that certification needs to meet the requirements outlined by the Council for Accreditation in Occupational Hearing Conservation. And that training historically has been all classroom training, so 3.5 to 4 days of classroom training, didactic and hands-on practicum. This effort, the Army Hearing Program is doing in conjunction with the Department of Defense Hearing Center of Excellence, is a joint incentive-funded program to transition training into a virtual environment. This was approved about 2 years ago and was in the works just as COVID struck. And as COVID-19 struck, we were able to transition our training into this virtual platform almost immediately because we were already moving in that direction. So over the last 6 months, the Army Hearing Program has trained over 180 technicians using a 2-phased approach. to hearing conservation training. The phase 1 is done through virtual means, either Adobe Acrobat or Microsoft Teams. Students join the classroom from all over the world. In our last class, we had students joining from Incirlik, Turkey, as far east as Incirlik, Turkey, to as far south as Honduras, and then across the continental United States, all joining together in one class and freeing up audiologists across the Army to spend time doing hearing conservation related activities and not having to spend those the equivalent of 2 days conducting training, where our staff does that training. Then we release the students to phase 2, where they go on site with their practicum instructor and get their hands on the equipment, learn how to conduct audiometry and practice conducting audiometry. At the end of that training, they take a standardized written examination, and if they successfully pass the written examination and the practicum evaluations, then they become certified and are able to go out and conduct hearing testing across the Army. So I'd like to demonstrate the capabilities of this equipment. I'll first start off with boothless audiometry testing, and then we'll move into personal hearing protection fit testing. Okay, so the first equipment that I'd like to introduce you to is the wireless automated hearing test system. I say wireless because there are no wires connected to this system. It connects or communicates with a tablet. So the audiometer is actually embedded in the ear cup, and the ear cups actually provide quite a bit of sound attenuation. That's why we call it a boothless audiometer, because it provides sufficient attenuation to conduct a valid hearing test in an environment that's not in a sound-treated room. Now, it doesn't mean that the environment can be super loud. It has to be done in a relatively quiet room, but almost any quiet room has low enough sound levels that we can get an accurate hearing test. During the test, the patient just watches the screen and selects that they heard the tone or they did not hear the tone. Okay, and we'll show that to you in just a minute. We're going to clean the audiometer and then put it on our patient, make sure that they understand how to take the test. So like I said earlier, technicians that operate this equipment must be certified to conduct a hearing test, so that they do need to be trained on how to use this equipment. Before we put the hearing audiometer on the patient's head, we'll give some instructions. So ma'am, when you take the exam, you're going to tap this red button. You can see it's a fairly large red button. Whenever you hear the tone, no matter how faint or distant the tone sounds. All right, so the next technology that we want to introduce is hearing protection check. This is a system that evaluates how well a person's hearing protector is providing protection when they are using it, when they have inserted it themselves and are using their earbud. This is important because it allows us to ensure that an individual that's being exposed to hazardous noise is getting as much protection as they need. So to do this, we present tones to the individual, and they respond without hearing protection in their ears. Okay, and we look at the lowest level that they can hear the tone that's generated by the earphone without hearing protection. Then we ask them to put their hearing protection in just like they would usually put them in We put the headphones back on and measure their ability to hear with the hearing protector in. We look at that difference, the difference between the unprotected and the protected results to get what's called a personal attenuation rating, or PAR. And this tells us how much hearing protection the individual is getting with those hearing protectors in place. Part of this test is to conduct a hearing check without hearing protection in place. So we'll fit the ear cups. All right, we're going to fit the ear cups over the ear. Make sure they're nice and snug. We're going to start the test by having the individual respond or scroll down on the mouse when they hear the tone. So they'll scroll down until they can't hear the tone, and then just gradually increase the volume until they do hear it. And they keep doing that until the system identifies the lowest level that they can hear. We're only going to test 3 frequencies, 500 hertz, 1000 hertz, and 2000 hertz. Now that we're done with the unoccluded check, we'll have our patient remove the headphones and go ahead and put the earplugs in her ears just like she would usually wear them. Now, this is a good time to educate the employee on hearing protection devices, how to fit the ear hearing protector correctly. It's also an opportunity for us to look at how much attenuation they're going to get, and perhaps they may need double hearing protection. So at the end of this test, we'll be able to instruct the patient on exactly how much protection they're getting. If they're overprotected, we can look at different hearing protectors that may lower their protection. If you overprotect somebody, that can lead to communication problems, non-compliance with use because of those communication problems in the workplace. So we don't want to overprotect an individual, but we also don't want to underprotect an individual because then that leads to hearing damage, and that hearing damage can be permanent. And we want to avoid any workplace injuries. So we'll go ahead and put the ear cups back on. Okay, so we'll put the headphones on with the earplugs in place. And then our patient will start the occluded test. Now we're going to start the occluded test. Now that the test is over, we can remove the headphones and the earplugs and instruct the patient on their test results. So in this case, your hearing protectors are providing adequate hearing protection. Your personal attenuation rating is 20 decibel, which is right around where the noise reduction rating for that earplug is. So given your general noise exposures, you're getting adequate protection. Have any questions? Okay. So the nice thing about getting the personal attenuation rating is that now we, as the hearing conservation professionals, we know that this individual is getting enough protection for the hazards that they are exposed to. So we can safely say that when they use their hearing protector in the manner in which they put it in by themselves, they're getting adequate protection. So I want to thank you for listening in today. We've gone over 2 technologies that are being made available throughout the DoD, boothless audiometry and hearing protection check capabilities. We believe that these technologies will really benefit the Army hearing program and safeguard the soldiers that are out fighting our wars and the noise-exposed civilians that are supporting our service members. We also discussed the hearing protection certification training and the joint incentive funded program that's in collaboration with the DoD Hearing Center of Excellence and the Department of Veterans Affairs, that improves and modernizes hearing technician training, makes it more widely available to a larger audience, and reduces the burden on local audiologists to provide that training individually. Also in the Department of Veterans Affairs, this training will allow technicians who are certified to see patients that are already established in the VA system for routine audiometry without any diagnostics, but it opens up the time for the audiologist to do what the audiologist needs to do and opens up access to care for our veterans and those that have served in the past. I want to thank you for joining us. If you have any questions, feel free to reach out to the Army Hearing Program at the Army Public Health Center. Lieutenant Colonel Merkley, Army medicine is Army strong.
Awesome, awesome, awesome video, sir. I know you're looking at yourself on camera like, hey, that's me, that's me.
Right.
Good afternoon, and welcome to
Hold on,
AUSA Now.
let's stop.
Oh.
There it is. All right. So, sir, I really appreciate that video that was done there. And I know some folks probably got some questions as far as, that you would be the expert, obviously, in answering. So let's go ahead and pull up some of these questions that we've got already.
Okay.
So the first question is, sir, what is the current status of the Army Hearing Program?
Well, that's a good question. So, this COVID situation really has affected the readiness of the Army in terms of hearing readiness. We're looking at overall, the Army sits at about 79%, including all compos, so Army National Guard, Army Reserves. And historically, we've been up in the high 80s to low 90%. So there's a bit of a dip in hearing readiness related to the reduction in hearing testing services across all compos. For the active component, our readiness was up in the 94 to 95% ready historically, and now that's dropped down into right around 87%. So we're actively working to get testing capabilities back up to where they were pre-COVID, using this new equipment because we're now going to be able to take testing out to the units, but also to free up some space in the clinic so we can use both in clinic settings and outside clinic settings to improve get hearing readiness services out to them. The injury rates across the Army stand right around 7% for the uniformed service members. So 7% of individuals across the Army Reserve, and National Guard are experiencing what's considered a significant threshold shift. For the active component, our injury or incidence rates rose this year to right around 5%. So we're actively looking at that, and also not just looking at the STS rates, but looking at follow-up compliance rates. So every time an individual comes in to get a hearing test, if they show a significant threshold shift on their annual hearing test, they need to come back and get it rechecked to determine if that's a permanent condition or a temporary condition. And we've seen that when there's good follow-up compliance, injury rates tend to drop because those the changes in hearing that we saw on the initial exam were either a temporary condition or just not real. They resolved on the follow-up. So we see if we have good follow-up compliance, STS rates drop. So we're focusing not just on injury rates, but also on follow-up compliance rates. Follow-up compliance for the Army, for the active component, sits at about 65%. And our goal over the next year is to bring that up to at least 70% across all compos, and the guard and reserve as well. Guard rates are in the low 20s, and the reserve component is very poor, and I won't go into that. But overall, there's been a dip in hearing readiness, and we are actively working to improve or get that addressed and get soldiers the hearing health care that they need and deserve. One other area of readiness, our percent of what's considered HRC4. So these are category 4 hearing readiness. These are individuals that we really don't know what their status is, and that has gone up significantly this last year, again related to COVID, to where we have almost 30% of the Army that we don't know what their hearing status is, and so we need to get them into a clinic or get hearing testing capabilities out to them so we can get them evaluated, identify any problems, and get those problems addressed quickly. So that's the general status of the Army hearing program, or the Army hearing at least readiness at this time.
Okay. Sir, the next question that I've got for you is, why exactly do we need to take so many hearing tests? You know, hey, I got a test done today. Do I need to go and take another one tomorrow, next month? Why exactly am I taking so many hearing tests?
You know, that's actually a really good question, and one that a lot of soldiers have. You know, by law, we are required to conduct a surveillance hearing test on an annual basis, and that's because the Army, exposes every soldier to hazardous noise, and that hazardous noise. What is hazardous noise? Well, hazardous noise is defined as a steady state sound, so an exposure to steady state noise greater than 85 decibel over 8 hours, which not a lot of soldiers go out and are exposed to that much noise unless you're in a tracked vehicle, or doing maintenance and maybe working around engines. There's aviation as well. Those are very heavy noise exposed MOSs. But some of us are in very quiet MOSs, and our exposure comes from annual weapons qualification. So every time you fire a weapon, you're being exposed to better than 140 decibel peak noise levels, and so we have to monitor anybody that's exposed to that much noise for legal purposes, to comply with our Department of Defense instructions 6055.12, and ultimately the Occupational Safety and Health regulations 29 Code of Federal Regulation 1910.95. So there's a requirement for an annual hearing test, and then if you show a change in your hearing, then you need to get a follow-up test, and DoD requires that you go through a follow-up test. This is not it's an Army requirement, but the Army requirement mirrors what the Department of Defense requirement is. So we will conduct a follow-up test, and if the change in hearing persists, then you get a second follow-up test. Usually that's done on the same day. So you'll go to the clinic twice, once for your annual and then once for the follow-up tests. If the follow-up tests then show that this is a permanent change in your condition, you will be referred to see an audiologist, okay, to determine, is this a temporary or permanent condition? Is it going to affect fitness for duty? Is it going to affect your ability to do your job? We need to know those things, because not all hearing losses are permanent. Some of them are temporary conditions that can be treated medically. And so we want to identify those and get soldiers the care that they need, but also identify how much is this hearing loss going to affect their ability to do their job. And so at most, a soldier, if they have poor hearing or a significant change in their hearing, should have no more than 4 hearing tests in a year. And that's by regulation. If you're having more than 4 hearing tests in a year, then you might look at, what are the local policies, and are the local policies mirroring what the Army actually requires? Because the Army doesn't require any more than those annual hearing tests.
Okay. Sir, the next question, and both are connected with COVID-19. The first part is, how has the current COVID-19 pandemic affected the hearing program across the Army? And what exactly is the Army doing to address the effects of the COVID-19?
Okay, thanks. So I kind of went over the statistics, or the current stats for the Army hearing program. And I think COVID-19 has affected us in that, we've had to not completely close down clinics, but most of our clinics have now had to socially or make sure that they're practicing social distance requirements. So their testing capabilities have been cut almost in half at most installations. So if I had a large hearing booth that would accommodate 8 soldiers at a time, now, due to social distancing requirements, that booth might only fit 4 individuals. So clinics across the Army are dealing with this differently. Some are extending hours so that they're open longer and can get just as many people through the booth as they could in a normal day. Others are simply curtailing testing until things open back up. What we are doing, so the Army hearing program at the Army Public Health Center sought funding for these boothless capabilities, this boothless audiometer. And we are in the process now of getting those in place. We will distribute those out to the sites that had the greatest needs, or were identified as having the greatest needs. And then those audiometers will be used in conjunction with the existing testing capabilities to bring their overall testing capability back up to what it was pre-COVID. And then they will have that capability to go out to sites that can't come into the clinic. They'll be able to go out and conduct testing in those sites, and then bring those test results back and enter them into the DOORS HC system. In addition to the wireless testing system that I mentioned and we showed in the video, we are also providing a limited number of boothless testing systems that are capable of conducting a diagnostic test. So this is a little different from what I showed in the video. This is a diagnostic audiometer. It sits, again, the audiometer is in the headset, and it's a tablet based audiometer, but it has capabilities of conducting air conduction testing, bone conduction testing, speech audiometry, and everything that we would need for a diagnostic exam. And we'll be able to take that outside of a booth. So if you need a capability to conduct a diagnostic exam, or increased capability to do a diagnostic exam, but you don't have the diagnostic booth, then you can take that system and use it. We are also contracting with personnel. So certain sites that identified a need for increased personnel strength to conduct these tests, they're getting some support.
Okay. So, sir, I had a question that was about the boothless technology, but I think you kind of answered that already. So maybe I could jump on to another question that I have.
Okay.
The question is, what other initiatives is the Army Hearing Program currently working on to help the warfighter?
So, yeah, a lot of things. I talked about the hearing protection fit check system, and that's a big effort. I think it will improve hearing protection, or it will improve our ability to identify that soldiers are actually getting the attenuation that they need. But in addition to that, we have advancements in hearing protection that have been made, and many of you might be familiar with the TCAPS program. It's a tactical communication and protective system program that was offered through the Program Executive Office for Soldiers, and the program was actually defunded. But when it was defunded, the need for that capability, hearing protection that has an amplification type device, that when a soldier dons their hearing protection, doesn't leave them with poor situational awareness. That need was identified, and so currently the Army Hearing Program is working with the Maneuver Center of Excellence to develop a requirements document for advanced hearing protection, the tactical hearing protection, and that will, if the requirement is approved, it will help bring those capabilities into the inventory, and there will be a requirement for that, because all things in the military are driven by requirements. And so we're really excited to be working with the Maneuver Center of Excellence on this initiative. But in parallel to that initiative, we're working with the Program Executive Office, the Program for Head and Neck Protection, to develop an evaluated or a qualified product list for hearing protection, so that hearing protectors that come into the inventory are evaluated to a higher standard, a higher military standard, and approved through this process. We think that will help bring better quality hearing protectors into the inventory. Not that the current hearing protectors are poor quality, but this is just a check on those hearing protectors to ensure that they meet the standards that we want, they have the capabilities that we need and that are identified in the requirements documents. And then we have the ability to go back and recheck those hearing protectors to ensure that the manufacturing quality is consistent and so forth. Because we're very interested in getting the best hearing protector into the hands of the soldier for the job that they do. When we identified, when the TCAPS program went away, the only requirement out there for hearing protection was to reduce noise, reduce noise exposure to 85 decibel, and that was it. It didn't mention anything about how the hearing protector affected situational awareness, and which is critical. And if you're in a combat zone and the only hearing protector you have is a standard earplug that reduces all sounds, well, the likelihood of a soldier wanting to wear that is very, very low, because it affects their ability to wage war. I've already talked initially about how hearing loss affects survivability and lethality on the battlefield. And then we send a soldier into battle and give them an earplug that reduces their hearing ability. Well, we know if they wear it, they're lethality and survivability is going to be affected. So we can't just have a requirement to reduce noise exposure. We need to reduce noise exposure, but also for our warfighters, improve and not allow that hearing protector to affect their ability to wage war. Now, we want our soldiers to be protected, but we also want them to be effective, and we want them to survive the battle. That's key. So I think this effort with the qualified product list and the requirements document with the Maneuver Center of Excellence will be huge in improving hearing protection for our soldiers.
Okay, excellent, sir. Let's ask a question in regards to the advances that's been done. So the next question, any new advances in hearing protection?
Oh, there are a lot of advancements in hearing protection now. There are hearing protectors for almost any job that you need to perform. Some have the microphones in the ear, so when you pop them in your ear, your situational awareness is just fine. At least for the most part, you can hear and understand what's happening around you. We do need to evaluate some of these products because they have a microphone in them and it makes it sound like you haven't lost anything. Our studies through our studies and investigation group have shown that even some of these earplugs can reverse your ability to detect sounds. So sounds that are coming from the front might sound like they're coming from behind. And so we want to make sure that these technologies actually work to our advantage. We want them to be, we don't want them to affect your ability to localize sound. But in addition to the microphones, there are hearing protectors now that have amplification inside. That if I'm sitting next to somebody that's wearing the same hearing protector, I can sit and talk to them, and it's communicating. It takes my voice directly to their ear without any wires. Or a radio. I don't have to be wearing a radio to communicate with those that are within a certain distance from me. And then there are hearing protection technologies, of course, that have radio systems that you can use a two-way radio. You can plug into the military communication systems. So there's lots of opportunity and lots of advancements out there. We just need to make sure that whatever we purchase and decide to use doesn't adversely affect soldiers' situational awareness. So I would caution soldiers about going and getting their own product before it has been evaluated for its effectiveness.
Awesome, sir. So regarding soldiers, what about our Reserve and National Guard? What are these initiatives benefiting these two parties?
Right. So our Reserve and National Guard, that's almost 30% of our Army resides in the Reserve and National Guard. And all of these initiatives are open to them. The hearing protection or the hearing conservation training that I mentioned through distance learning, that has already benefited the Reserve and National Guard. We had soldiers from West Virginia and Connecticut join in one of our courses, and then we took the practicum out to those states through an agreement with the state. So they were already benefiting from that, and that in and of itself is helping improve hearing testing across the Reserve and National Guard, and that they're not having to contract out for so much testing. They're able to actually do the testing in-house, ensuring that the records get into the correct medical system and the readiness system that we use. So that's an initiative that I think has already benefited the Reserve and National Guard. The technologies in boothless hearing testing are almost certainly going to benefit these groups in that, the footprint that's required for conducting hearing tests will get much, much smaller. They won't have to purchase big testing suites or a big van to drive around and do all their hearing testing. They can get their hands on boothless technology, get it out to the field, conduct their testing, and then bring it back in and enter it into the doors HC system. So I see a lot of promise with that technology. And then the personal or the hearing protection fit checks are going to benefit the Reserve and National Guard just the same as it does the active duty Army. Our reservists, many of them are working in very quiet jobs during the week, and then out on the weekend, they're flying, they're riding around in Bradleys and tanks, firing off cannons, and we expose them to a significant amount of noise. So we need to make sure that they're being adequately protected, and this is a step toward ensuring that they are being protected adequately.
Excellent. Sir, we've got two more questions. Where can Army leaders turn for assistance?
Well, that's a great question. And what we want, every installation has most installations have a hearing program manager. If it's an installation that has a uniformed audiologist, leaders should already be turning to that individual for assistance. If they don't have a hearing program manager, then they can reach back to their regional audiology consultant. Each of the regional health commands has an audiology consultant, and those units can reach back to those audiology consultants and get the support that they need. And those consultants will know who's available at each of the installations that can provide that support. And if they are not able to get the support that they need, leaders can certainly reach back to my office at the Army Public Health Center, and our staff is wide available to provide assistance to the field and or direct leaders to where they can get that support. Another source of information for leaders is the Department of Defense Hearing Center of Excellence. The Hearing Center of Excellence has a website that has a lot of information related to the hearing conservation program across the DoD. And they have resources available, posters, video, like DVD, public service announcements, and training videos that can be used. And those materials are free of charge to anyone that can order through the government printing office. So I'd encourage them to, if they don't get what they need from us, check out the Hearing Center of Excellence. But we have posters. The Army Public Health Center has a lot of materials that we've developed and videos that we can certainly push out to the field, and we're very ready to provide support.
Awesome. And sir, the final question of our panel today is, what is the Army Hearing Program doing to address the 2021 Safety, Occupational, and Environmental Health Goals related to hearing?
So, yeah, this is, again, a good question. These goals were just recently published, and kind of go back to where I was talking at the beginning. The goals are to reduce injury rates across the active component by 3% for military personnel. So the reduction in STS rates by 3%, and to civilians by 4%. Now, historically, we want to get those STS and injury rates down to 3% or better, because right around 3% is where you start running into the naturally occurring hearing loss rates in the general non-noise exposed population. So if we get down, if we can lower our STS rates to right around 3% or better, then we know we're running a very good hearing conservation program. Now, on the civilian side of the house, it's the same process, but our STS rates among civilians are quite a bit higher, and some of that's due to the fact that some of them come already into the employment with hearing injuries, and then follow-up rates on the civilian side are a little poor. So we're working on that as well. But if we can reduce our STS rates by 4% in the civilian population, then we'll be right on track to where we need to be as an Army hearing program. The follow-up compliance is something that we really need to focus on, because with good follow-up compliance, we get a good look at what the actual injury rates are in the Army. So our goal is to increase or improve follow-up compliance to 70% or better. So we want, 100% compliance would be absolutely wonderful. But we're realistic. So we're going to start at 70%, hit that goal, and then we'll gradually improve that. I think these are very achievable goals over fiscal year 2021 or calendar year 2021. I don't remember if it's fiscal or calendar, but we'll work very closely with local hearing program managers. We'll work closely with the occupational safety and health community at these installations. We're working with our public health communications folks to get the word out on these safety and occupational health goals, so that individuals are aware of them and can be thinking about what they can do to affect a change in those STS rates and follow-up compliance rates.
Excellent, sir. I think you've given out a lot of good information today that many people can take back to their units. Hopefully they're inspired by the new technology that we have, that, obviously you can provide Army hearing protection, testing even in a boothless area, and of course learning about the different policies that's being initiated, so that our brothers in the reserves and National Guard, brothers and sisters in the reserves and National Guards can also receive that hearing protection that's needed. Sir, I really appreciate, and the Office of the Surgeon General really appreciates you coming and sharing your medical expertise, and also an update as far as what we've got going on for this AUSA OTSG presentation, sir.
Well, it's been a pleasure, and I appreciate all those that participated in this. I want to thank Colonel Blank for being my guinea pig for the video.
Mm-hmm.
Colonel Blank is the Army audiology consultant, and just did a great job with that. So I'll close out by, that mantra that Army medicine is Army strong, and I truly believe that. And I thank you.
Absolutely, sir. Hang out in the broadcast room. I'll talk to you in a little bit there. And so we have come to a close as far as all of our live streams for the Office of the Surgeon General. Lieutenant General Dingle really appreciates the past couple of days that you've spent with us, learning about the different advances in Army medicine, the things that we've done for making sure that your family members, yourself, active duty reserve veterans, and of course, our National Guard and Reserve make sure that their medical care is taken care of through even this new reality, this new world that we're living in. We're going to have a survey being sent out to you. We ask you to please fill out the survey. Fill out the survey as much as you possibly can. Fill it out completely and send it back to us. That survey is coming to you. And I've enjoyed my past couple of days live streaming with you And I'm looking forward to future live streams and future work working with Army Medicine and, of course, the AUSA conference. And as I say in closing every time, Army Medicine is Army Strong. Thank you.